I will state for the record that Westcat is here to record the meeting. We welcome them. They're here with our permission. Is there anyone else here from the press or anyone else who would like to record this meeting? Hearing none, we will get started. I will also state for the record that we have our Public Health Director, Jared Orsini, our Sanitarian, Jason Belmonte, and our Administrative Assistant, Tiffany McCarthy, present. And on the phone with us is our Public Health Nurse, Tiffany McCarthy.
Lorraine Donovan.
What did I say, Lorraine McCarthy?
No,
Tiffany McCarthy.
Tiffany.
Oh,
Like, you said it twice.
okay. Lorraine Donovan is our Administrative Assistant, Tiffany McCarthy is our Public Health Nurse. Sorry about that, Tiffany. Have the members had a chance to review the minutes?
Yes,
Any corrections or additions or changes?
I saw none.
Is there a motion to accept the
So
minutes?
moved.
We have a motion, and a
Second.
second, all in favor?
Aye.
Aye. The minutes are approved unanimously. Why don't we proceed to our Health Director report?
Okay, so in lieu of a report, I prepared a statement which will outline where we are currently and what has transpired so far in regards to surveillance for coronavirus. So the department has been monitoring the emergence of coronavirus since late January, early February. Since we began conversations here on prevention and preparedness, we were engaged by Mass Department of Public Health to conduct surveillance of individuals coming back to the United States from China who were asymptomatic at the airport and told to self-quarantine at home for 14 days. Under the supervision of the public health nurse, these individuals were instructed to take their temperatures twice daily for 14 days and to call either the nurse or myself to report any fever or respiratory symptoms. The 14-day period for those individuals has lapsed and they have been cleared. During this time, we've been receiving updated guidance from DPH on the presence of coronavirus in the state and guidance on handling potential cases to reduce the opportunity for community spread here on the local level. I gave a presentation to the town of Westwood department heads on proactive steps they can take in their offices to reduce the risk of respiratory illness among their employees and town residents with whom they interact. Through the extraordinary work of the Department of Public Works and school department custodians, all municipal buildings are being sanitized daily to limit the potential spread of disease. We have plans in place to deal with multiple scenarios regarding coronavirus exposure. These plans are based on the most up-to-date guidelines from the Centers for Disease Control. In addition to CDC, our partners at Mass DPH have been readily available for consultation and advising local boards of health on the most up-to-date information on new cases or reports of exposures. Mass DPH has issued and will update school-specific guidance to the Department of Elementary and Secondary Education, who will then communicate that information to the Westwood Public Schools. As a reminder, the best way to prevent infection is to avoid exposure to the virus. We cannot recommend more strongly everyone take standard precautions to help prevent the spread of this virus. Washing your hands often with soap and water for at least 20 seconds, thoroughly drying your hands afterward. If hand washing is not available, using an alcohol-based sanitizer. Avoid touching your face. Avoid close contact with people who are sick. Staying at home when you are sick. Covering your cough or sneeze. And cleaning and disinfecting frequently touched objects or surfaces. Shortly before our meeting, as you're aware, Governor Charlie Baker has declared a state of emergency due to coronavirus. We will review the content of the declaration with Mass DPH and the whole of the town government and make necessary adjustments to our policies and procedures shortly thereafter.
Any questions? Do we have any confirmed cases of coronavirus in the town of Westwood?
No,
Not at this point.
not at this point.
You sent out a packet of material. We appreciate that. Pretty thorough. What I'm hearing, Roger just mentioned before he got here, he was listening to NPR, I was listening this morning, is that these precautions, people need to understand it's not about them, it's about everybody else. And I think it's very, very important that anyone who is symptomatic avoid the public buildings, stay out of the schools, stay out of the Council on Aging, stay out of Town Hall, stay out of the Board of Health, because all you're doing is exposing that to everybody else, and particularly the public servants. We have terrific public servants in this town. And if they start contracting this virus, it's going to really restrict the services that they can provide to the people in town.
Right, and I would extend that to the individual workplace as well. I mean, the key message that DPH is promoting is that people should stay home when they're sick, because at this point, given the potential community spread, no individual can be certain that what they may think is the common cold or flu might be something else. So the best way to be proactive is to stay home.
And Tiffany, you're monitoring it as well.
Yes, I'm back. I'm sorry for that. Here I am. And yes, I'm monitoring these. I'm sorry, I just missed like the last minute what you guys were saying. You were just talking about people not coming into work if they're sick and such.
That's right.
Yeah. Would you mind explaining briefly, Tiffany, the MAVEN process and the reporting process so that people in town understand what we're doing, what you're doing to monitor it?
Yep, exactly. So what happens, the state gets notified of a potential risk exposure, whether it's travel or a contact of someone who may have been a presumptive case. So through the state system, I get notified in a confidential system. The state gives me a phone call, an email, and this website that I have to check daily. So with that information, I get the name of the contact and telephone number and address, and I have to reach right out to them, whether it's day or night. And then I have to call them and talk to them every single day, make sure they're checking their temperature, make sure they have no symptoms, excuse me, and make sure, their family's being safe, if they have to be quarantined, whatnot. And we just go through the process every single day, and they're monitored for 14 days, and they have contact with me every single day. And if something comes up, if they weren't feeling well, any symptom, they notify me, I notify the state, and they notify their doctor as well. So it's actually a pretty good process that seems to be working right now, so hopefully that stays that way.
And it's not just for coronavirus.
No, it's for everything. I get there's a whole slew of lists, hundreds of reportable infections and diseases that get reported, whether it's salmonella, suspect Lyme cases, Campylobacter, any food-related things. So I get notifications every day about people, and I have to follow up with that. And so let's say it was a foodborne illness, that's an important one, so that's why I have to contact the person's doctor. I contact the person itself. We go over if they eat in any local restaurants. We track if they work in a hospital. Like, there's a whole slew of questions and packets that you have to fill out, and it just helps the state and us figure out where this may have come from.
And that's what the whole staff is doing, all of you. We appreciate all you've done, all the preparation you've made. The town is really appreciative of what you've done. You've done a good job.
Thank you very much.
But we try.
Any other questions on this issue?
No, I think the major issue relates to the testing, because there's so many people who have a cold or the regular flu, and there's no way to tell whether they have the COVID or coronavirus. And until we get more tests, we won't be able to answer some of those questions. Unfortunately, the World Health Organization test was not accepted by the administration, and so we're trying to catch up in developing tests.
Are we overreacting?
No. According to the person with whom I was just listening to, someone from the School of Public Health, he estimates that between 40 and 70% of adults will have contracted the virus at some point.
Wow.
And hopefully that dissemination is something that's slow and not suddenly we get big clusters all at once.
But it is cold and flu season. I'm sure if you go into any elementary school in the country this time of year,
correct,
they'll all get runny noses.
Oh, yes. Yeah.
Mm-hmm.
Right.
But we have no tests to separate who's got the flu, typical upper respiratory infection, or the coronavirus.
Okay.
Right, so the key, I think, message too is they're moving into this model where it's, social distancing and isolation in a lot of cases to, the best way for people to separate so that you're not interacting as readily, so it'll slow the spread, as the governor said today, so we don't overwhelm the medical system. So taking these steps, that they're outlining and have outlined will hopefully slow the spread in communities so that the emergency care and the hospital workers have ample time to properly treat each case.
And you're comfortable that if, or when, positive cases are realized here in Westwood, you've got procedures ready to deal with it?
Our plan in place, I think, is solid. And it's based on, our conversations with Mass DPH and, that they've gotten from CDC. And depending on the scenario, it'll elicit an outcome that's, hopefully will be effective to limit the number of cases, if there are any, that are here.
That would include the whole gamut.
Yeah.
Jared, did the governor say anything in his talk about schools anticipating?
He said that the DESI would get revised guidance from DPH tomorrow. He mentioned things about travel and some talk about large gatherings. I think that'll be, I think that was a wider message too, to start to have conversations on gatherings. And so that was kind of the gist of it. So there will be new guidance coming out, he said, tomorrow from DPH to DESI. Which then all the public schools and
DESI?
It's the Department of Elementary and Secondary Education. So that they've issued previously a guidance document directly to the schools, I think February 2nd-ish, which talked about how they're handling reported cases or symptoms in schools, and this document tomorrow will be a revision of that with hopefully increased guidance.
Do you know how many Westwood residents are now in self-quarantine?
Tiffany may have that answer.
Am I allowed to give specifics? I'm not sure what I can say. I just can't give names or anything. I'm.
You can give
What am I allowed to say?
Without disclosing any names, can you give us any numbers?
Yep, I could. I have. There was 3 that are now done, all set, fine. Quarantine is over, and there's 3 more that they're still in the process of a quarantine.
And the root or the cause of the quarantine, was that exposure to someone from East Asia, or can you give us that?
I can't get further into that.
Okay.
It's just a possible contact, whether it's travel or exposure of a person, and that's really much the gist of what they say. And then my job is just to reach out to them daily and just make sure that they're, staying quarantined and make sure their family's safe as well. More information obviously would get released if, something turned positive, I'm assuming. But like I said, for HIPAA and privacy, there's very little, limited information that I can say about it.
Okay. But you'd have some flexibility if they did test positively. Just to
Yep, so
alert
it's really a
anyone when
case-by-case
events
situation, and when the state even tells me, when I've even asked, what can I share, what can I not, really it's one of those things, let's say a case does become positive, then the story will change and I'll be able to possibly share more.
Okay.
I would never, and the other thing too, the person would have to give permission for us to disclose anything. So as you see in the town of Norwood right now that's going on, where they were saying the town manager was positive and they gave his name because he gave permission to, let his information be released. Otherwise, that's why the other people, they said, other officials and such, they won't say the names because there's very little that they can say.
Yeah, maybe I'm just asking the obvious, but if you know
Yeah.
someone's positive, you need to be able to alert people who may have been in contact with them.
Oh, absolutely. So that's what happens. Right now I have nobody that's positive. It's people just under quarantine, and they're supposed to notify me, like I said, if they become symptomatic. That's when they would get approved. I'm sorry, I cannot talk. They would get approved for testing, and then we would go from there. And if someone was, presumptive positive, I would get notified, they get notified. Everyone in their family would get quarantined. And then we'd go from there. We'd work with the state, get a list of any other close contacts and such, and, go from there.
Okay.
Kind of like a domino effect.
Yeah, we're just thinking out loud here. We're just
Yeah.
preparing preparing for the worst.
No, I get it. It's scary because it's the unknown, and it's one of those things that our answer today could be different tomorrow just because everything is changing so quickly.
And the other members of the Board of Health were all available on an emergency if necessary, if things got
Thank you.
worse. We would meet again.
Okay, appreciate that.
All right, we have Tiffany's Public Health Nurse Report. Are there any questions on that? Okay, I have a motion that we accept it as presented. Second, all in favor? Aye.
Aye.
Great.
Do we have any other topics or issues?
Our focus has been this, so at this point, I would say no.
All right, well, I thank all of you for all you've done. Yeah, Chris, want to pull up a chair? Okay.
Keep the distance, right?
Touche.
So my name is Christopher Coleman. I'm the town administrator here, so thank you for letting me speak. I just wanted to speak and say thank you to the board and the staff, especially the staff, for educating our employees, educating our residents, and working with us, and allowing us to vet and vent some of the frustrations and misunderstandings that we have. They've been fabulous, and I just want to say thank you.
I agree.
Thank you.
I agree. You've been terrific. It's been very reassuring. All right.
Thank you.
Anybody else? No? Motion to adjourn?
So moved.
Meeting's adjourned at 5:16. Thank you, everybody.